Yay. Let me know when you're ready to record.
We are going. You can go anytime you like.
Thank you. Hello, my name's Deborah Cannon. I'm a member of the League of Women Voters of Clallam County, a nonpartisan issues-focused organization. I'm the Voter Services Chair, and I'm also your moderator for tonight's candidate forum, which is focusing on hospital commissioners. The cornerstone of our democracy, voting, is a primary focus of the League. Ensuring voters know how to register, how to track their ballots, what issues are, and providing unbiased candidate information so we can make informed decisions is key to serving our mission. I appreciate you listening and taking interest tonight. For this race, there are 3 open positions with 2 candidates running for each position. I want to thank these 6 candidates for participating tonight. We have Anne-Marie Henninger and Gerald Stephanz for position 1, Carleen Bensen and Tara Coffin for position 4, and Penny Sanders and Laurie Force for position 7. There are also many volunteers that are focused on running a smooth forum. I'm grateful to all of them, including Sarah Morrison and the team from the North Olympic Library. Thank you very much. Please note we're recording this forum, and in a few days we'll post a link on the League's website. It's www.LWVCLA.org. We also post links on the League's Facebook. Over the past week, we've received thoughtful questions from the community. Thanks to everyone who took time to submit questions. In some cases, multiple people submitted similar questions. We've done our best to combine them in a way that allows us to cover as many questions as possible on a wide range of topics in a non-biased fashion in the time we have this evening. The forum format will have for each candidate a 2-minute opening statement in ballot order for each position. After that, we'll move to the question portion where each candidate will have 90 seconds to answer, alternating. At the end of the forum, each candidate will give a 1-minute closing statement in reverse ballot order for each position. I'll call out your names so you don't have to remember. Before the forum this evening, we made sure all the candidates were able to see the timers. Now let's put that to use. For the 2-minute opening statement, we've asked candidates to tell us why they're running for the commissioner position, what their qualifications are for serving, and what their goals are while in office. So we're going to lead off with Anne-Marie Henninger running for position 1.
Thank you. Good evening, everyone, and thank you to the League for hosting this forum. I appreciate that. I'm Anne-Marie Henninger, your incumbent nonpartisan commissioner for position 1 and the OMC board president. I'm a wife, mom, and nurse with a 29-year history of living on the peninsula, along with working and volunteering here. I've served as a dedicated and compassionate nurse for 35 years. Through my nursing vocation, I work in an outpatient clinic as a child care health consultant and as a nurse manager at the Swim Free Clinic. I am also being trained as a sexual assault nurse examiner, and I'm a certified rural health nurse. My qualifications include current and relevant OMC board experience, organizational and historical knowledge, a deep understanding of governance versus operations, achieving Washington State Hospital Association governance certification every year of my term, clinical expertise, and membership on 3 other boards. I possess a passion for rural healthcare, OMC, and public service, and I bring to the board both the nursing and patient perspectives. I am a steadfast servant leader. I'm running for re-election because I am ready, willing, able, and enthusiastic to do the work needed to keep OMC operational and sustainable. My goals for the next 6 years are identical to the reasons that I'm running for re-election. 1, keep OMC open and successful today and ongoing to meet the healthcare needs of our community. 2, strengthen and fortify OMC for whatever is ahead. 3, advocate always. 4, select a permanent CEO. 5, continue to make intentional financial and operational decisions for OMC's best. And 6, witness the fruits of those decisions, for example, the UW-Medicine affiliation and our strategic initiatives. I'm here tonight to provide you with facts free from rhetoric. I am self-financing my campaign. I am not soliciting donations, accepting endorsements, or receiving guidance from a partisan group. I look forward to our interaction tonight, and I thank you.
Next, Gerald Stephanz, also running for position 1.
Good evening, and thank you to the League of Women Voters. My name is Jerry Stephanz, and I'm running for Hospital Commissioner, District 2, Position 1. My wife and I moved here in 2015. I'm a retired doctor. I spent the last 10 years volunteering with the Olympic Peninsula Community Clinic, the former VMO Clinic, as a volunteer physician, medical director, and board member. I run a homeless shelter medical clinic on Wednesday nights and help bring the Rediscovery program into existence. I've served on the Clallam County Board of Health since 2017, currently the treasurer for St. Andrew's Episcopal Church, and was privileged to be named the 2022 Citizen of the Year by the Port Angeles Chamber of Commerce. My vision for Olympic Medical Center is to keep it open and in local control. Our hospital commissioners have failed in their administrative and budgetary oversight. They've been $56 million over budget the last 3 years. OMC has failed several Medicare quality surveys this year that could result in the loss of Medicare hospital certification and reimbursement. If Medicare payments are lost, the hospital will close. Our CEO, CFO, COO, and CNO have all resigned, and there's no plan to start a search for replacement, while the taxpayers pay $700,000 a year for an interim CEO. During my career, I have served on and chaired multiple hospital committees and have participated in many Medicare surveys. I have served on the board of directors of a large independent multi-specialty clinic in Utah with multiple clinical sites that had its own cancer center, pharmacy, dialysis facilities, imaging center, and physical therapy service. I've served on national nephrology organizations as a board member and headed its legislative advocacy program for several years. I served on a regional Medicare advisory board for several years. We need detailed financial information and selection of a strong permanent CEO and C-suite to ensure survival of OMC. I will be transparent, available, and responsive to all in Hospital District 2. Thank you.
Thank you. Carleen Bensen, you're next.
Hi, I'm Carleen Bensen, and I am running for position 4 on the Commission for Clallam County Hospital District 2. The reason I'm running is because I really care about the patients in this community, and I want to keep the hospital open and available for them for their health care. I feel like my qualifications, I've been a physician in this community for 33 years, practicing urology, both in private practice, and then I was employed by the hospital. I also am a part-time jail doctor, which has been rather interesting. My experience has been, I think, very valuable. I've been on the hospital medical executive committee. I've been chief of surgery. I've been chief of staff. So I've worked very closely with the hospital administration in those roles. I'm committed. I came out of retirement to help keep the clinic open this past summer, and when we were really short of urologists. So I'm very committed to healthcare in this community. And I have the time and energy. Now that I'm retired again for the second time, I have the energy and the time to devote to this role, which is going to be quite a bit. Things have changed a lot since I filed, and it is rather astounding how much work is going to need to be done. I think that my goals as a commissioner is to make sure we pass our state inspection so we don't lose our Medicare, get out of the fiscal hole that we've fallen into, hire a new CEO, and establish a partnership with some entity, whether it's UW or some other entity who can help us achieve 1, 2, and 3. Thank you.
Thank you. Tara Coffin, you're next.
Hey, my name is Tara Coffin, and I wanted to say thank you for the League of Women Voters for facilitating this, and thank you for my fellow candidates for being here. When we had a conversation in the summertime, it was really enjoyable to hear from everybody. So I'm so excited to be here with y'all. So I grew up in a rural community. I've lived in Western Washington pretty much my whole life, and one of the things that struck me growing up in Western Washington in a small town was that healthcare is not necessarily right out your back door. There's geographic barriers that impact access to healthcare. There are funding barriers that impact access to healthcare. And these are things that are particularly salient to rural communities like Clallam County, like surrounding communities out on the Olympic Peninsula. And my background means that I'm very interested in some of those barriers. I have a training in public health and have done extensive work in community-based participatory research. And I bring that up not because I want to talk about qualitative research, although I would. I'm a hoot at a party, lots of really nerdy jokes that come out. But I bring that up because a lot of the focus of community-based participatory research is letting the community drive decision making that influences public health outcomes. Listening to the community, listening to what the barriers to healthcare are within a community. And I think all of us that are here tonight will certainly agree that there are a lot of barriers that are currently facing rural communities in terms of healthcare. So I am very passionate about being here to listen to the community and figuring out ways that are community driven to address some of the hurdles that we're currently facing.
Thank you. Penny Sanders will lead off for position 7.
You need to unmute, Penny.
Yes. All right, I'll start all over again. Good evening. Thanks to the League for inviting us once again to talk about serving as a hospital commissioner. And I just would say as an aside, who knew that the campaign for hospital commissioner would be the hottest item on the ballot this time. I'm really glad to see the conversation around our hospital and healthcare in our commission, in our community. I am a candidate for position number 7. After the board interviewed 5 finalists in March, I was appointed to fill the vacated commissioner position. And this is a 2-year term. And I am seeking to complete that term, which expires on December the 31st of 2027. A bit about me. I've lived in Port Angeles for 20 years, and during this time, I have been actively involved in a number of healthcare community issues. You may remember the issues around the Virginia Mason 8th Street Clinic about 20 years ago. I was in the middle of that and very involved in helping stabilize primary care in this community. I am by profession an elder advocate. And as such, I understand the critical need for care and local access of care in our communities. I know how challenging it is to take people off the peninsula for care, and I want better care here. As a newly appointed commissioner, I have been dealing with a lot of issues in the last 6 months, both financial and operational. I've been part of some very tough decision making. Therefore, I want to continue that work, to continue the stabilization of OMC, both operationally and financially. That's my commitment.
Thank you, Penny. Laurie, you're next.
I just found the unmute button. Thank you for inviting us to participate tonight. My name is Laurie Force. I'm a retired nurse practitioner with 40 years of experience in home health, hospice, and in the hospital at the bedside as a wound consultant, educator, and clinician. I moved from Renton in 2019. I used my skills as a volunteer at Olympic Peninsula Community Clinic, our local free clinic in Port Angeles. I quickly made a home here, and it was reassuring to know we had a thriving community hospital. It was not an easy decision to run for the board. It's really a challenging job with lots of moving parts. It's an enormous responsibility. But Olympic Medical Center isn't thriving now, and I feel compelled to step up. The job of the board is setting policy, supervising the CEO, monitoring quality, and approving expenditures. The board is accountable to the public and by law must deliberate openly, when making decisions, except in certain narrow circumstances that allow for executive session. There is real harm in not meeting the intent of our sunshine laws. When the public is not kept informed and suddenly becomes aware of a serious problem, like our quality issues that have in the survey, during the survey process, if they become aware of a serious problem, there's an erosion of public trust, and it's hard to regain that trust. The hospital's reputation suffers. My clinical experience is grounded in commitment to open, respectful dialogue, allowing me to match my skills to the needs and goals of patients and families. These skills are needed on the board. If I'm elected to serve, I will lead with my core values of accountability, transparency, and respect for everyone in the hospital and community. Thank you.
Thank you, Laurie. We're going to turn our attention to questions now. The first two are related to board decision making. To what extent are elected officials expected to take public comment into consideration when making decisions, and how are they to balance it with other sources of information? And what are those other sources of information? We'll start with Gerald Stephanz first.
Thank you. I think it's absolutely paramount to involve the public in board decisions, particularly in terms of the crises we're having at Olympic Medical Center right now. We have some serious financial problems right now, and it's very likely that the hospital may have to contract. We may have to consider losing some services, and the hospital needs to be or the public needs to be at the forefront of those decisions. In terms of balancing other information, I think it's important to get all sources of knowledge on a particular issue, whether it be from local politicians that can help you in terms of any kind of reference material you can find related to the topic. I think it's just so important. I can't underscore the importance of public comment in board decisions. Thank you.
Thank you. Carleen, Bensen?
I concur completely with what Jerry says. Public comment, input is critical. One of the things that I've been doing since I decided to run for commissioner is I've been talking to a lot of the stakeholders at the hospital, people that I've worked with for years, people that I know, and what do they see are the issues? What are the things that they are most concerned about? So I don't even, I've been going to the commissioners' meetings, I've been listening to the public comment, but I've actually been going out and seeking more public comment from people that are involved with the hospital. I think this is absolutely essential for a community hospital. As Gerald says, we are going to have to make some pretty serious, hard decisions. And I think if you have everybody on the page, it makes it a lot easier to talk about how and why we need to make those decisions. So as far as other resources, I have been very active in the State Urology Society and the National Urology Society. These are places we can get some information on how other places are doing things well. And I think that's something that we need to tap into as much as we can. Thank you.
Thank you. Tara Coffin, next.
Excellent. This is a great question. I see elected officials in general, particularly in a hospital setting when public health is really the primary topic of discussion, elected officials play a role of a facilitator in my mind. And by that, I mean that I even drew a little visual. It's probably not going to show up well, but the idea being that on the one hand, a elected official is there to ensure certain regulations are met, people are being legal and doing all of the things that they're supposed to in accordance with the Washington Revised Code. On the other hand, there's public need, there's public expression. And an elected official has a unique role and really an opportunity to be able to facilitate conversation and push and pull between those two voices, on the one side being the regulations, on the other side being public need. That facilitator role includes education, it includes facilitating conversation, it includes making sure that the public is heard and making sure that the public has the information and the tools they need in order to make informed, um, uh, not necessarily choices, but to be able to engage in an informed manner with an understanding of the regulation. So I really look forward to hopefully playing that role of facilitator and helping to kind of balance and making sure there's an equal exchange of information from what the regulations are saying versus what public expression is.
Thank you. Penny Sanders? I think you're muted.
I thought somebody was unmuting me. Okay. Tara, great response. And I really like this question, but I want to go one step further than just the people who show up at board meetings. I have the opportunity to talk to a lot of people who are consumers of healthcare in our communities, and they come from all walks of life, all parts of the social strata. That is what defines me as a candidate. I hear voices that often are not heard, are not present at the table. I had someone want to discuss the laundry with me the other day at a coffee shop, and they had some great observations, which I actually shared today with an appropriate staff person about this person's reaction to the laundry. So I see us as able to bridge into many aspects of the community and bring that back to the discussion, so that when I am sitting at the table making policy for the hospital, for healthcare in the community, I am thinking about the persons who have to go off the community, off the peninsula for healthcare. I'm thinking about the people who have to use paratransit to get to the hospital. It is a broad spectrum that defines the work of healthcare in this community. And I really want us to be tuned in to that broad community as we seek to provide the best healthcare we can for a total community.
Thank you. Laurie Force?
Super.
Yes, I 100% agree that the role of communication with the public is just essential to the role of the board commissioners, and that involves all people in the community, the patients, families, but also all the staff in the hospital, from support staff to the bedside staff, the physicians, therapists, you name it. We all have a role, a stake in our hospital, and hearing those voices and responding with reasoned information to the public at the time of the communication, I feel is just essential to a two-way dialogue that contributes to the best solutions that we can come up with for all of us. And it's, an example would be how do we grow in an environment, in a time when our finances aren't really allowing it? We need to make it really clear that we can't be everything to all people. And yes, I'd love to grow and expand services, but first we have to stabilize what we have.
Thank you. Anne Marie?
Deb, would you go ahead and repeat the question for me?
Yes. To what extent are elected officials expected to take public comment into consideration when making decisions, and how are they to balance it with other sources of information, and what other sources would you utilize?
Great. Thank you so much for repeating that. First of all, when I think of public comment, I think of it in the meeting setting. And so we always have opportunities for public to speak during our board meetings. In fact, we've put that now at the beginning of the meeting, so folks have the chance to offer their public comment and then go about their business if they need to go somewhere else. Public input is incredibly important to the board. It guides our decisions. And so board members' contact information is available on the commissioner website. Folks can and do reach out to us in person, by telephone, via email to share their thoughts, to share their concerns, to ask their questions. I think that public comment or input begins at the ballot box. So for example, when I ran for election, the people spoke, and they spoke with a 65% majority to elect me to represent them. And so that is what I have tried to do over the last 6 years. I've also maintained an attitude of approachability and receptiveness to the public at all times. Public interest is always at the forefront of the decisions that we make, and our decisions that we have made are being implemented now. Public comment has exploded this year at our meetings. We've had far more people attend and offer public comment in person or virtually, and we absolutely welcome that. Other sources of information would be things like data, metrics, dashboards, subject matters, and our community partners. And those are also important in making decisions about what's best for OMC. Thank you.
Thank you. Okay, our next question also on board decision making. Executive leadership often changes, or changes often occur as a result of a new strategic alliance. The OMC board chose to treat ex-CEO's notice of retirement in 6 months as an immediate resignation, rather than using that time to start the recruitment process for a new CEO and have some overlap. Based on your knowledge, was the board transparent with the public in the specifics of what led to the decisions? We will start with Carleen, and we understand some of you are on the inside and some of you are on the outside. So it's based on your knowledge. What did you see?
Well, quite frankly, I didn't see anything. There wasn't any transparency. All of a sudden, out of the clear blue sky, we heard that Gerald was leaving, and I was shocked, surprised, and I still am not quite sure the details of this. It would have been nice to have had some kind of cushion other than like a week to get a new person in the CEO field. So yeah, I really don't have any kind of insight into this at all, any more than anybody else does.
Okay, thank you. Tara, your observations?
Yeah, I think this is a good question, and I think it's one that's important for there to be communication around, both in terms of where the concerns are coming from the public. Any answer I personally would give is my opinion. And I don't know if my opinion is what's important if this is a question that's coming from members of the community. I think one way I would want to approach this kind of question or concern is to learn more about that perspective, that position, and figure out where there are opportunities to improve communication regarding board decision, whether that communication is here's exactly what's happening, or whether that communication is, you know what, this isn't something that we can share publicly at this time, and this is why. I'm very hesitant to share what my personal opinion is, but rather I'd really be interested in hearing more about concerns and figuring out how there can be some opportunities to improve communication between board, regulatory bodies, and policymakers and the community who they are serving.
Thank you. Penny Saunders? I think you need to unmute.
I'm unmuted. Yes, thank you. Some of my comments are, of course, going to have to be a bit constrained because I am a sitting board member and I was on the board when the previous CEO did offer his resignation. What I would say is that upon the resignation being proffered, there were absolutely pressing concerns in OMC. there were both the financial concerns and the emerging issues related to the DOH CMS survey that needed immediate action to ensure that the hospital could continue on and that changes would be implemented, especially as it related to the DOH. I believe we took strong action to install strong leadership. And I believe as a result of those actions, we have seen real movement towards stabilizing the hospital, both in terms of the operational issues related to DOH and the financial issues that, we can continue to hemorrhage money, or we could get someone in there who could begin corrective action to start taking the necessary financial change, initiating the financial changes that need to occur. I make no apology for what happened.
Thank you. Laurie, Force.
Hard time with this mouse. Sorry about that. I was at the meeting when the resignation was announced, and I got the clear impression that that Gerald was anxious to move on for personal reasons, and there was definitely no clarity that he actually had offered 6 months of notice. So I would say, in answer to the question about transparency in this issue, there was no transparency. There may be good reasons for choosing to accelerate the looking for an interim CEO, but in terms of transparency in that process, it wasn't there.
Okay. Thank you, Anne Marie.
Absolutely. Thank you for this question. I am incredibly proud of the Board of Commissioners for the way they handled this situation. When Mr. Wolf proffered his resignation, we acted immediately to interview search firms and narrow that down and recommend to the board a search firm that could procure a stellar interim CEO for us. So this idea that the public is entitled to information about personnel matters does not carry weight. This is a personnel matter. The details are not open for everyone's information and knowledge. And so, yes, Gerald resigned. He had personal reasons for doing so. He's moved on. We immediately interviewed and obtained a fantastic interim CEO who brought on a fantastic interim CFO, and we are moving forward. And so this idea that we've not been transparent is inaccurate and false. Thank you.
All right. Let's see. Last in this question, Jerry Stephanz.
I disagree with Commissioner Henninger. There is absolutely no transparency in this process. I think it is a matter of conjecture exactly why, and I do know that Gerald had planned to leave at the end of the year. I think this really reflects poorly on our Board of Hospital Commissioners. They have failed to exercise their primary role in supervision of the C-suite. And they've done so at cost to the taxpayer. I think with all probability, you could have started a search for a CEO while Gerald was there. You may have had even internal candidates, and you would have avoided a $700,000 a year annual payment for an interim CEO, which, by the way, we got a consulting firm to do this. The consulting firm did all the vetting, and there were just simple interviews of this. And I think that's entirely the wrong way to go about this. Thank you.
All right, thank you. We'll move on to a question about service lines. While serving as an elected board member, how will you demonstrate your support for legally required services in Washington State that might be in conflict with your personal moral views? Examples that were submitted were retention and financing of reproductive health services such as tubal ligations, miscarriage management, abortions. Another example was a broad example allowing end-of-life options such as palliative care. and supporting death with dignity laws for patients who want those options. We'll start with Tara Coffin.
I'm getting kind of caught up on the idea that palliative care in and of itself could be a package that conflicts with somebody's personal beliefs, since palliative care is just making sure that you have your symptoms attended to and are improving quality of life rather than quantity. That being the case, that being like a mental hiccup that I'm struggling with, I uh, am a full believer in ensuring people have access to the healthcare that they need. So from a issue with my personal beliefs conflicting with what is a legal requirement to ensure people have access to at public hospitals in the state of Washington, I don't foresee there being a conflict. But I think if there was a situation where I felt uncomfortable with something that was a legal requirement within our state. I am a public health researcher, so my inclination is to learn more about it. Why am I feeling conflicted? Why is it something that is a legal requirement? Is it something that should be a legal requirement if it's not? I mean, I think my role as a commissioner and as a policymaker and as somebody who has dedicated their entire professional life to public health and to working any way I can to ensure people have access to the healthcare that they need. I want to understand what the problem is, if there is a problem, and I want to figure out a way to solve it in a way that works for the people that are represented.
Okay, thank you very much. Penny Sanders.
Thank you. When you step in to take the position of commissioner, one of your obligations is to support the laws of the state of Washington. Those are the laws that guide healthcare and keep the hospital compliant with statute and regulations. I have to leave whatever private views I have at the door. Abortion, reproductive services, tubal ligation are offered at OMC. And I believe we have said this over and over during this campaign. They are there. Medically assisted aid in dying is an available service. It is not by statute offered in the hospital, but we have providers who do take steps to make sure that people who desire this service can receive it. Now, I'm not sure what else we can do to ensure that people receive the services they want and they ask for. It is my obligation as a commissioner to see that the full range of services is offered for everyone in the community to participate in. Whatever else I think doesn't count. It's my role as commissioner to serve this community.
Okay, thank you. Laurie Force, you're next.
I believe that all of these decisions should be private between the physician and the patient, but I would even go further to say that we need to make sure the patient feels supported. If there's any reticence on the part of patient's provider to actually support their decisions. And end of life to me is what the issue here, I think, is medical aid in dying. I have a 97-year-old friend in Port Townsend who recently fell and broke his hip and has decided that this is what he wants and his family is on board. What I learned was that because he has no home to go back to, he has the option of being admitted under general, I think it's called general admission, as when the bed is available, to go into the hospital in Port Townsend to self-administer his medications. And I'm really curious at this point why this is not something that is happening here. The support for medical aid in dying throughout Clallam County is pretty limited as far as I can tell.
Thank you. Anne Marie Henninger.
Very good, thank you. So this is an issue that comes up repeatedly. It was a topic when I was running for office 6 years ago. And when I took a vow to be a commissioner, I vowed to uphold the law. I do uphold the law through my service as a commissioner. OMC upholds the law. When I ran the last time, people said that I was going to threaten the secular nature of OMC and that I would overturn Roe v. Wade. While I was flattered that people thought that I had that level of power, OMC actually started performing abortions in 2023. So that's something that I have not interfered with, I have not commented on, I have not obstructed. I uphold the law. OMC complies with the laws in Washington state, and that goes for abortion services and medical aid in dying. Physicians can write prescriptions. It does not occur on our hospital campus, and those providers or nurses or staff that do not want to participate in it can have the opt-out option. Thank you.
Thank you. Jerry Stephanz, you're next.
I think I'm going to agree with everything that everyone's already said. As a physician, medical decisions are between a patient and the doctor, period. And if it's legal, it should be offered. And that's my answer. Thank you.
All right. Thank you. Carleen?
I concur with what everyone has said as well. It is between the patient and the physician, or the practitioner in the case of a nurse practitioner or PA. It is entirely, politics, the government should get out of this kind of stuff. But as long as we're following the law of the state, I'm happy with that. And I will go right along with it. I have no problems with that whatsoever.
Okay, thank you. We'll move on to a different set of topics. This has to do with board expectations. Multi-part question, ask me to repeat if necessary. One, what's your availability for board meetings, committee work, other organizational events such as fundraising? What are your expectations of the board and the organization? And how will you evaluate if the board is being effective? So we'll start with Penny Sanders.
Well, first, I will tell you in all candor, everybody who is running for this office needs to be prepared for how much time board membership takes. That has been the biggest surprise that I have seen. This is a serious board that takes a serious commitment. This is not just something to put on your resume. You have to be prepared to study. You have to be prepared to sit in meetings. You have to be prepared to serve on at least 2 and possibly 3 subcommittees. And you have to be prepared to take on extra duties as the demands of the hospital and the position that the hospital is in at this point require. This is a hospital that is in need of strong leadership, both from the board and from the C-suite. And we have got to stabilize this hospital, both operationally and financially, and it's going to take time. So, what was the other piece, Deb? I'm sorry.
How will you evaluate the effectiveness of the board? What are your expectations?
What are my expectations? Well, one of the things that will be my expectation is when the board can see 6 months of strong financials. And that will say that the policies that we are supporting and have put in place are working. That will be the first measure, is the financial stability of the hospital and the effectiveness of the board in achieving that.
Okay, thank you. Laurie Force.
So board expectations. This has a lot to do with why I was initially reluctant to run for office, but I do recognize that there are intense demands on the time of the commissioners, and am prepared to step up as I have no employment to have to compete with that, and that's a good thing. In terms of evaluating effectiveness of the board, I think that goes right back to what are the board responsibilities. and they are assuring financial stability. And in the last 3 years, the hospital has lost $50 to $60 million. The job is to supervise the CEO. I think that part of that of effectiveness would be relating to both offering the CEO some very measurable outcomes that you expect them to keep, and then making sure that you stay on task with that. Monitoring quality issues is another area where the current board kind of dropped the ball, and that's clearly part of it as well. I need to stop. Thank you.
Thank you. Anne Marie Henninger.
Thank you kindly. First of all, I want to address that topic of quality and say that I have been pushing for the release of those DOH and CMS reports since June. So I just want to get that out of the way. Regarding the board availability, yes, I have it. During July and a lot of August, I was working about 40 to 50 hours as a commissioner because so much was happening. So I am available, and I will continue to be available. The expectations that I would have for my board would be to read and abide by the job description, be able to meet those requirements, become governance certified every year, communicate with the board and with the board president, participate in meetings and get current before the meeting so you're prepared for what's going to be discussed, oversee that CEO and ensure that he or she has data points or metrics that they have to achieve. And then I want every commissioner to remain current on what's happening in the healthcare landscape. As far as evaluating the board's effectiveness, every year we do a board assessment on how we're doing, and we take that information to see where are our strengths, where are our opportunities, and not just talk about that, but then we make a plan for the next year. How are we going to address our areas of strength to make them stronger and our areas of opportunity to improve in those ways? The other thing I would add for this board at this point in time is we need to be consistent and stable. The best option for the board at this time is to have only one commissioner turnover. Thank you.
Thank you. Jerry Stephanz.
Thank you. This is going to be a hard job, and it's going to take a lot of time, 60, 80 hours. It's going to take not only in terms of board, it's going to take time with the staff. And I have lots of time. I'm ready to do it. I'm not afraid of hard work, and I'm not afraid of homework. In terms of expectation of the board, civil and a vigorous discourse in public information, and how to evaluate the effectiveness of the board. We've talked about finances and quality, but I would like to touch on something else. I've been doing a lot of walking and knocking on doors the last couple of months. And one thing that I found two big messages, and you kind of can consolidate that into one. There are a lot of people that have lost trust in our hospital. There are a lot of people that say, I won't go there, I'll go to Jefferson. There's a lot of people that are concerned that they might have to move out of the area because the hospital won't be there when they need care. And so I think the biggest thing to evaluate how effective the ward will be at 6 months, 12 months, 2 years, are people coming back and do they trust the hospital? Thank you.
Thank you. Carleen Bensen.
Thanks. That's a very interesting question. Yesterday was my last day of working in the clinic. So I am pretty much free and clear. I work the jail 2 days a month, 2 afternoons a month. Other than that, I am totally retired and have lots of time. My husband's on the golf course all the time, so I have nothing to do while he's golfing. So I've got lots of time to do this. And if I happen to be out of town, which is not very common, but when I am, there's certainly a way to address meetings with Zoom or Teams, Microsoft Teams. So I have absolutely no problem committing lots of time. I'm a former physician. I mean, I've been a physician. I'm used to working long hours and long days. And like Jerry, I don't mind hard work or homework. So keeping up with stuff will be great. It'd be something that I really feel like I can do this. As far as judging the effectiveness of the board, I was very encouraged by today's meeting, board meeting, with the presentation by the interim CFO. We're going to have some numbers to look at now. And that will be very, very helpful to see how we're doing from a fiscal standpoint and also the regulatory standpoint. I think it's just critical. Again, we've got to pass the state regs. So those are the things I think would be the way to measure board effectiveness, financials and quality. Thank you.
Thank you. Tara Coffin.
Yeah, I need y'all to know that it is killing me to sit still right now because I have some pretty awesome ADHD that allows me to bounce around, which kind of influences and informs my answer to this question. So I'm not retired. I have a full-time job. I have 3 kids. I have a lot of chickens. However, I don't think that precludes me from incorporating the duties of being a commissioner, a hospital commissioner, into my life. And one of the reasons I say that is because I think it's really important when you have a elected body, a group of people who has been elected to represent a community, that they actually represent the community, right? This is not just a community of folks that are retired. This is a community of people who are retired, of people who are families, who have kids in the school system, who have recently given birth in the last, well, I guess not so recently, at OMC. My youngest is 2 years old. So I feel like even though my schedule may look a little bit different than some of my fellow candidates, I think that that's important to incorporate those types of positions and perspectives into the board. As far as evaluation, I have 10 seconds. I have a master's in special education and a doctorate in public health, and that research and that experience has given me extensive knowledge and experience in conducting evaluations in healthcare systems.
Thank you. We'll turn to a couple of financial questions. What is your level of expertise in reviewing and comprehending financial information and asking detailed questions? And also, what is your experience in reviewing large-scale studies regarding public health? And we'll start with Laurie Force.
The first part was experience in interpreting financial statements. Is that correct? The
Yes,
first
reviewing and
question?
comprehending financial information, asking detailed questions.
Yeah. I do not have any formal education in finance. However, I do understand a lot of the processes that go on in the hospital because of my experience there in terms of what impacts the bottom line. And I'm not afraid to ask lots of questions. What was the second part of the question?
Your experience in reviewing large-scale studies regarding public health.
When I obtained my master's in nursing and worked towards my ARNP, reviewing studies of all kinds, including public health studies, was a huge part of that education.
Okay, thank you very much. Anne-Marie Henninger.
All right, so I have a solid understanding of reading and understanding or comprehending a financial statement. I will say that today's financial report was presented to us in a format that was different. It was new, but it was phenomenal. And our interim CFO is a teacher who really made things clear and understandable, not just for those of us on the board, but those in attendance. I serve on the Budget and Finance Committee, so that's a committee at which we get perhaps a little more granular and ask more of the deep dive questions, but I have no hesitation about asking questions about things that I don't understand. I will confess that a few years ago, I did have to Google how to understand a financial statement for dummies, something along those lines, and I found it very informative because finance is not my background. And the other thing I'm quite excited about is that our interim CFO is not just an interim CFO, he's also a faculty member at the University of Washington. And he just yesterday offered the opportunity to teach the commissioners more information about finances. And I am very excited for that because even though I've been in this role for 6 years, there's always something more to learn. And I'm eager to hear what he has to teach us about. So I'm hoping that the rest of the board will also take advantage of that. As far as research, I'm very comfortable seeking research, reading research, and understanding research. Thank you.
Thank you. Jerry Stephanz, next.
Yes. In terms of my expertise and ease in reading financial statements, I'm very comfortable with financial statements. I may be the last doctor to actually own his own practice and manage his own practice financially. When government regulations set in that I could no longer afford, our practice could no longer afford a medical record, I merged it with a larger practice. In my capacity in a national nephrology organization, I did chair the business committee and efficiencies committee. I did participate in actual in our multi-specialty clinic in Utah in our business aspects of that, including looking at performance for different ventures that the clinic had for different service lines. In terms of interpreting medical literature, I have no problems looking at medical literature. I did a research fellowship, not in public health, in molecular biology, but I have no problems with that. I was on the Clallam County Board of Health during COVID. We did a lot of public health information at that time. Thank you.
Thank you. Carleen Bensen.
Okay, so the first part was, could you repeat the question again, please? I'm sorry.
Yes. What's your level of expertise in reviewing and comprehending financial information and asking detailed questions? That's part one.
Okay. All right. So this is not my strong suit. I have to, be very honest with you. But when I first came to town, I had my own practice, own private practice, and I did work on all the management aspects of that. And I have served on the American Urological Association Coding and Reimbursement Committee for several years. So on a national level about how the coding and the reimbursement works. So I have that experience, which is also part of the financial picture. As far as my experience in reviewing large scale public health information, I am constantly learning. I am constantly reading about various things, and public health is one of those things. And so I feel like that's part of being a doctor, is staying current with all this kind of stuff, including public health. And so I don't have any problem reviewing that kind of thing. I think I'm pretty much on top of stuff like that. So hopefully, it would be great if the new CFO will teach the board a little more financial information. That would be a great thing. Thank you.
All right, great. Thank you. Let's see, Tara Coffin.
I'm so excited for this one. I'm going to kind of answer both of them together. So a lot of my expertise and experience reviewing financial information has some significant overlap with my experience participating in and running as a principal investigator different types of public health studies. A lot of the public health studies that I have worked on, either as a member of the research team, as a independent reviewer conducting IRB review for these studies, or as a principal investigator, has focused on, again, how can we make care more accessible? for specific populations. And I have a special interest in historically marginalized populations, which include rural communities. And part of the how to make it accessible is the financial piece of it. And so understanding how to interpret the finances that are in existence, how to put into place different evaluation tools or checkpoints to ensure that we're being smart with how our money is being spent, and how to recalibrate where money should be going to ensure that there's a focus on primary care and to emphasize reduction of preventative hospital readmissions and things like that. So public health research is like, that's where my heart is. That's really what's brought me to be interested in this commissioner position, and I will stop.
Okay, thank you. Penny Sanders. I think you're muted.
I can't unmute. Well, I hate to tell you all, but I was a bit of a financial dweeb in a previous life. I was Kentucky's Inspector General for Schools, and as such, I oversaw a $4 billion budget. And then I was responsible for overseeing the integrity of 176 school districts. So I've spent a little time looking at budgets. I've also, in my life, been part of teaching courses in school finance, as well as doctoral level courses in research and design. There, I'm really boring. However, some of my most interesting time has been spent on other boards where we did oversight of major research projects that were ongoing in both behavioral health issues and in issues related to some early work that was done in learning disabilities. So I've had a long career, with much of that career based in looking at research, writing research, talking about research, and spending time looking at significant budgets. All budgets are a challenge, but I feel fairly comfortable looking at a spreadsheet. I want to echo what Anne Marie has said. Today's board meeting was a masterclass in helping people understand OMC's budget, and I was pleased to see that. Thank you.
Great. This is our next to the last question. Again, it's financial. OMC continues to have financial issues. On July 3rd, Congress passed the One Big Beautiful Bill Act, which included many changes to Medicare and Medicaid. How will this affect OMC? What are your biggest concerns for our patients in our rural hospital? And we'll lead off with Anne Marie.
Thank you for the question. This is a huge topic and will have significant impact. Recently, last week, I was able to watch a slide deck from the Washington State Hospital Association specifically on this topic and the projected impact that it will have. The things that concern me about it are the fact that a lot of people will probably fall off Medicaid, and how do we be proactive as an organization to identify those folks, reach out to those folks, educate those folks, and then help them to maintain their health insurance. This idea that our SNAP funds may be frozen or, in fact, diminished over time. Currently, we receive about $12 million a year from that, and maybe not next year, but the year after, that's going to be an incremental decrease, so that will impact our organization. We have to get ahead of this. We have to be proactive, and there will be a financial hit to the organization as well, so we have to be able to accommodate that as well. My desire and my goal is really to get the word out about what's coming, what it's going to look like, how it's going to impact our community, and how we as an organization can help and be proactive. Thank you.
Thank you. Gerald, Stephanz, next.
I am the medical director and board member for the Olympic Peninsula Community Clinic, and we serve underinsured or non-insured and marginalized patients in the county. And so this has been a big, overwhelming concern of ours. I think functionally and operationally over the next year, particularly, the ACA subsidies will go away. Most of the folks on that are younger, perhaps not as many health problems, but that'll impact the hospital because they won't seek care. And when they do seek care, they'll go to the emergency room and it'll be uncompensated care. The other problems we're going to have will have come after the midterm, where the Medicaid work requirements come into effect. And we will have to work very hard to, when there is a process in the state that decides how how it will be verified, the work requirements. Our clinic will have to scramble, and other clinics, Nome, Jamestown, the hospital will have to scramble to look to see how we can make sure that we can push patients through that process. We already know historically from other states that have had a work requirement that this is going to be difficult. It will involve a large sum of uncompensated care to OMC, and we need to plan for it. Thank you.
Thank you. Carleen Bensen.
There we go. Everything that Jerry and the other folks have said is absolutely spot on. We're going to be seeing a lot of uncompensated care when people lose their Medicaid, when they stop getting their subsidies for the ACA. They're going to show up in the ER with nothing, and we're going to get nothing for that. So the more proactive we can be of getting people into making sure that they keep their Medicaid. And I think partnering with our state legislators is going to be key in this as well. They can hopefully help us get a little better handle on how this is going to impact our individual people in the community, and support our work on a state level as well. It's kind of scary. This is not going to be good for our folks. And I feel horrible for the folks that are relying on Medicare and ACA, or Medicaid and ACA, excuse me, because the rug's being pulled out from underneath them. It's not okay.
Right, thank you. Tara Coffin.
This is a really important question. I think on the one hand, we have an advantage in that we're not the only rural community that's going to be impacted by this legislation. And being able to look at what other rural communities are doing, this is going to require innovation beyond what we have had to implement as a state, as a community, as a county. So I think relying on the knowledge of others that are in the same place, the learning points, I think is going to be incredibly critical. And to that effect, emphasizing and figuring out new ways to implement and to get primary care to people, because ultimately it's good, solid primary care that saves us a lot of money in the long run and makes it so people aren't just showing up to the emergency room for primary care because that's the only option they have. I don't know exactly what the solution looks like, but I know that it's going to take a lot of research. It's going to take a lot of communication. It's going to take a lot of listening to other healthcare institutions that are in the same boat. And moving forward the best we can with what resources we have. If we're losing some of those resources, how do we make up for it? One way is to potentially implement smarter healthcare and making sure we're adopting learning points from around the country.
Okay, thank you. Penny Sanders.
I want to take a little different tack here. One of my concerns is that OMC at this juncture, in its weakened financial position, is more vulnerable to what is happening federally. And it is why I am so anxious that we begin trying to strengthen our financial position as quickly as possible and to take all appropriate action to get us to a stronger level so that we can better ride out what the future is going to bring us. I still remain hopeful that at the federal level, that there will be some bipartisan conversation that focuses around the subsidies for the Affordable Care Act. That to me is one of the keys to hopefully beginning to stabilize care across the spectrum of need. And I may be a Pollyanna, but I am hopeful that there will be some conversation about that. I want us to, over the next several months, really look at how we can handle the projected cuts that will be coming our way, and it will be critical for us to determine how we maintain essential services as a hospital that is the sole provider for 100,000 people in a very, very rural part of the country. Thanks.
Thank you. Laurie Force.
Yes, loss of Medicaid funding, loss of ACA subsidies, the Medicaid work requirements, all of these are going to mean people losing benefits and more uncompensated care to the hospital, less primary care because people won't be able to pay for that. And at the uncompensated care at the hospital is absolutely required. You know, we have to stabilize people before they can leave the hospital. It is unfortunate that all of these added pressures are coming at a time when we're behind the 8 ball in our finances, which have been declining for over 3 years. And so I do think that creative approaches like I do know at OPCC, although we provide free care, we also help patients apply for Medicaid. And we may need to expand a group of volunteers who can help keep patients going with things like their Medicaid work requirement records and all of the other pieces of that to help keep them still registered as Medicaid patients.
Okay, thank you. We're running close on time, so what I'm going to ask you to do with this next question, and I'll read it to you. A new CEO will be hired in the coming year. What qualifications do you prioritize and why? Give your answer in 5 words. And we'll start with Jerry Stephanz.
5 words. Okay, that didn't count.
We'll give you like 8 extra seconds.
Innovative, able to look at hospitals, rural hospitals that are doing well.
Okay. Thank you. Carleen, Bensen, your 5 descriptors.
Okay. Rural experience, fiscally responsible, and someone who can network.
Okay, thank you. Tara Coffin.
I'm all over the place. Focus on trust building and improving representation. I don't know how many words that was.
It's close enough. Penny Sanders.
Networking, I agree, is critical. And being able to identify priorities and have the financial and operational skills for a successful operation.
All right. Laurie Force.
Humble, people-oriented, flexible, responsible. If we count people-oriented as two words, I've done my 5.
All right. Let's see, Anne Marie.
Absolutely. So I'm looking for a strong communicator, someone with rural expertise, someone who's financially savvy, who can prioritize well, who is a leader, and who will partner with all of the entities around us to provide healthcare.
Great. That concludes our segment on questions. We ask that each one of you give a 1-minute closing statement explaining why we should vote for you. And we're going to start with Laurie Force.
The current board has exhibited bad stewardship in its responsibilities to ensure financial stability, supervise the CEO, monitor quality issues, and openly communicate with our community regarding issues of critical importance to the future of our hospital. We need new commissioners. If elected, I will work with other board members to do what it takes to keep the hospital open and locally accountable, vigorously pursue an alliance with the UW, recognizing it's not a bailout, live within our budget, fully evaluate all restructuring options for their value in stabilizing OMC, provide clear expectations to the incoming CEO, get private equity out of the emergency room, ensure that medical choices remain private between patient and provider. I would be honored to have your vote.
Thank you, Laurie. Penny Sanders.
Yes, thank you for inviting me here tonight. It's been a wonderful conversation as usual. I've spent the last 6 months as a commissioner. I have participated in some really tough decision making and understand very clearly that we cannot let our hospital fail. I am committed to the survival of OMC as a public hospital. That is my sole goal. I am a fully independent, unbiased decision maker, and I'm committed, as I said, to the success of OMC and not to any group or any political position. I'm not seeking any endorsements. I'm not taking any contributions, and I'm not guided by any politics or partisan group. I'm asking for your vote and your support, and I am asking for that to finish this 2-year term. Thank you.
All right. Tara Coffin.
I think it's interesting that so many different perspectives have been presented tonight, and I think that's really important. That's valuable, and that's what we want to be happening large scale. Nearly 50% of all rural hospitals in the United States reported financial losses in 2024. Nearly 50% of all rural community members have been cited as being underserved by their health care. This is not a problem that is unique to Clallam County. This is not a problem that's unique to Western Washington. And this is not a problem that's going to stop because of a simple solution that's there. This is a problem that is going to take a lot of voices, a lot of representation, a lot of communication, a lot of ideas, and there's just been the tiniest sliver presented tonight, and my goal would be to see more of that as commissioner.
All right, thank you. Carleen Bensen.
Thank you again for this opportunity to present in a forum like this, and I would ask for folks' votes. I think that I have the education, the experience, the commitment to the community, and the energy to do a good job as the commissioner. I will do my dead level best to do the best that I can. I don't mind working hard, and I really am committed to keeping a good, functional, viable hospital to take care of the patients in Clallam County. Thank you.
All right, thank you. Let's see, Jerry Stephanz.
OMC is in far worse condition today than 6 years ago when my opponent first took office. A hospital commissioner should be able to see trends. If you see multi-million-dollar budget overruns several years in a row, you should ask questions, identify why you're over budget, and fix the problem. That didn't happen. Earlier today, my opponent, noting there could be 3 new hospital commissioners elected, stated it might be disruptive to the process. Our current commissioners allowed OMC to get in a precarious situation. Do you really want to keep them in office? I think we need disruption. We need new leadership. If elected, I pledge to have regular, clear communication with the public in regards to what decisions are made and how final decisions are reached. I will include OMC providers and staff in decision-making. I will address OMC financial health through publicly asking tough questions and ensuring a balanced budget. I believe medical decisions should stay between a patient and their medical provider. I have the clinical, administrative, and advocacy experience to be an effective hospital commissioner. I humbly ask for your vote November 4th.
Thank you. Anne Marie Henninger.
Point of clarification, folks, I did not say that it would be disruptive to have a significant turnover on the board. I stated that it would be destabilizing for the organization and the board. So why should you vote for me over my opponent? I want to be your hospital commissioner. In contrast, my opponent sent an email in May during filing week stating, I really don't want to be a hospital commissioner. As recently as last month, he informed my husband that he is ambivalent about running for office. I, on the other hand, am experienced, enthusiastic, and energized. I'm a 29-year resident with deep roots and strong service. I'm committed to OMC's mission, future, patients, providers, and staff. I'm an incumbent with relevant and significant OMC board experience and a proven track record of steady leadership. I am a collaborator and a team player and an optimist. I am a devoted nurse. I'm running for re-election with no agenda or axe to grind other than doing whatever it takes to keep OMC here, open, and serving our community. Please remember to vote for Anne Marie Henninger for re-election to the OMC Board of Commissioners, Position 1, and tell at least 10 other people to do the same. Thank you.
Thank you. Thank you for participating tonight. Thank you for the listeners. The candidates have taken the bold act of running, and it's certainly not going to be an easy number of years ahead of you. But it's now our turn to vote. There are 3 websites we'd like you to write down: votewa.gov, vote411.org, and LWVCLA.org. These are key in helping you register to vote, track your ballot, find and view past forums, and we encourage you to talk to anyone who you know who is not registered and encourage them to go to these websites and register. The ballots are going to be mailed out on October 15th, and they can be mailed in, they can be placed in one of the ballot boxes. General Election Day is November 4th. If you think someone isn't registered, let them know that they can register by mail or online through October 27th. They can also register at the courthouse as late as Election Day on November 4th. One other thing that we would ask you to emphasize, everyone should know there's room to improve ballot returns, specifically for age groups under 44. The average data over the years shows less than 30% voting for that group of registered young voters. So please encourage everyone to vote, but especially those young voters. We ask everyone to vote, talk to everyone you know about voting, and make sure everyone has a plan to get in their vote. So this form is being recorded. There'll be a link to the recording posted on both the League of Women Voters website and our Facebook. Once it's posted, be sure and spread the word among your friends who couldn't join us live so they can track the issues and make informed choices. I think that's all for tonight. Again, thank you very much for participating. Good night.